Okay, I thought today we would just go over a quick review of our heart blocks. We'll just review what makes a first, second, and a third degree heart block, and then look at a couple little practice strips. So a first degree heart block we said was not a true rhythm. It is a description of a prolonged PR interval. So we have a conduction delay in the AV node. The impulses coming from the sinus node get to the AV node, and the AV node just holds it for a little bit too long before it lets it go down to the ventricles. The reason I say it's not a true block is because every P wave is going to have a QRS. So we will have one P wave to one QRS. It's just that hold in the AV node is a little longer than it should be. So that's going to impact our PR interval, we said. Instead of having a PR interval that's 0.12 to 0.20, we're going to have a PR interval that's going to be 0.21 or greater. So in this example here, I have one P wave to one QRS. P to P to P marches out, R to R to R marches out, but when I look at my interval measurements, I notice that from the beginning of the P wave to the beginning of this QRS, I have over 8 boxes. It's about 8.5 boxes right there. So that's going to be 0.32. But you're also going to notice that it's the same measurement here and the same measurement here. Even though the PR interval is long, it is constant. It has a fixed set value. So I would have to chart this sinus rhythm with a first degree block. But when we're talking about second degree heart blocks, type 1 and type 2, or third degree heart blocks, that is the rhythm by itself. So with our second degree AV block, which is also known as a Mobitz 1 or a Wenckebach, we said R to R to R to R is always going to be irregular. Okay, second degree type 1 is always going to be irregular. I will have more P waves than I have QRSs. So there's nothing wrong with the sinus node. P to P to P to P marches out. R to R to R is irregular, but I'm going to have more P waves than QRSs. So I will actually have P waves that are missing a QRS. Now, when I say more P waves, they're not a sawtooth, they're not a flutter wave, they're just a nice, normal, rounded sinus P wave. So the trick to a second degree type 1 is when I go to that PR interval, we said our PR interval here is going to get a little bit longer, is going to get a little bit longer, and then it drops the beat. That gives the AV node a chance to recover, and the pattern will start back over again. Now, a second degree AV block type 2, also known as a Mobitz 2, can be R to R to R can be regular or irregular for this rhythm. So in this example here, I notice that R to R to R is irregular. It looks almost like the one directly above it. I see that I have more P waves than I have QRSs, so I start thinking I have a heart block. And when you first just eyeball this rhythm to this rhythm, it's like, well, it looks almost like it's exactly the same strip. But now you go to that PR interval. In a second degree type 2, your PR interval, the P waves that have QRSs, is going to have a fixed PR interval. So this measurement from the beginning of the P wave to the beginning of the QRS will be the same here, will be the same here, will be the same over here. It's not progressively prolonging like it did up here. It has a fixed PR interval, but we do have extra P waves that don't have QRSs. So this makes this a second degree AV block type 2, also known as a Mobitz 2. So in this example, it is irregular, but second degree heart type 2s can also be regular. It can be regular or irregular. So in this example here, I see that I have P waves without QRSs. Okay, P to P to P marches out. R to R to R in this case is regular as well. It marches out as well. But I know I have a heart block because I have those P waves that have no QRSs. So now I need to determine, is this PR interval progressively prolonging, or is it fixed, or is there just no relationship? So when I look here from the beginning of the P wave to the beginning of the QRS, this measurement right here is the same as this measurement right here, is the same as this measurement right here. So it's a fixed PR interval, which makes it a second degree AV block type 2 at a rate of 30. Now up here you notice it says a 2 to 1 block, and you don't have to document that, but what that's referring to is I have 2 P waves to 1 QRS. 2 P waves to 1 QRS. So I have 2 P waves, 1 QRS, so it's considered a 2 to 1 block. Now, but what you really have to document is what the rate is. So, for instance, a second degree AV block type 2 at a rate of 50 versus a second degree AV block type 2 at a rate of 30. It's going to be more rate dependent as to what type of symptomology we see. And then our third degree heart blocks, R to R to R is regular. P to P to P is regular, but when I go and I look at that PR interval, it's going to be constantly changing. So from this P wave, and sometimes the P waves get buried in the QRSs or in the T waves, doesn't mean they're not there, we said. So P to P to P marches out, R to R to R marches out, but when I go to look at my PR interval, this is not the same as this, is not the same as this. There's just not a relationship between what the sinus node is doing and what the ventricles are doing. So this is going to be a third degree heart block or complete heart block. So I found this it says heart blocks. Do you have a constant PR interval? Then maybe it's a first degree. If it is a constant PR interval, it can also be a second degree type 2 if we have more P's than we have QRSs. If it's a variable PR interval or PR interval is different, we will either have a second degree heart block type 1 or a third degree heart block. In a second degree type 1, we'll have that progressively prolonging PR interval and then the dropped beat, where in third degree, the PR interval is just going to be continuously different. So when we look at some strips here, in this first example here, I see that I have an irregular R to R. I know these are not marked for 6 seconds, but let's just count the rate as if it was a 6-second strip. So I have 1, 2, 3, 4, 5, 6, so rate is 60. I see that I have P waves right here with no QRS. So I have P waves with no QRSs. So I start thinking I have some type of heart block. And again, as I mentioned, there's nothing wrong with the sinus node. So P to P to P to P to P marches out. So now I know I have a heart block. I need to go to that PR interval. I need to see, is it progressively prolonging and then dropping a beat? Is it fixed, or is there no relationship? So when I look from my PR interval from here to here, that measurement is the same as from here to here, which is the same as here to here, which is the same as here to here. So it is fixed. So this would be a second degree AV block type 2 at 60. Now this particular example, I see that I have P waves with no QRSs. And again, these are not sawtooth flutter waves. Those would just be ongoing. These are nice normal rounded P waves that happen to march out. So P to P to P marches out, R to R to R marches out, but I know I have a heart block because I have more P waves than QRSs. So now I want to know what type of heart block it is. Sorry about that. My PR interval, this measurement, looks exactly the same as this measurement, looks exactly the same as this one, looks the same as this one. So it would be a second degree AV block type 2 at 40, also known as a Mobitz 2 at 40. This one right here, QRS to QRS to QRS to QRS is irregular. My rate is 1, 2, 3, 4, 5, a rate of 50. I see that I have a P wave with no QRS. And again, my P waves, they look like nice, normal, rounded sinus P waves that march all the way across my strip. So I'm thinking I have a type of heart block. So now I want to know what kind. Is my PR interval progressively prolonging? Is it fixed, or is there no relationship? So my PR interval here, from here to here, it looks like it is about 6 boxes. Here, when I measure it from here to here, I notice that it is 1, 2, 3, 4, 5, 6, 7 boxes, so it got a little bit longer. Now when I measure from here to here, it looks like I'm 5, 6, 7, almost 8 boxes, got a little bit longer. And then from here to here, it's almost 9 boxes. So I have a PR interval that is getting here, it's getting a little bit longer, got a little longer, got a little longer, and then it dropped the beat. Now it's going to start that process over again. So this would be a second degree AV block type 1, also known as a Winky block, and this would be at a rate of 50. This top one here, QRS to QRS to QRS to QRS is regular. My rate is 40. I see that I have extra P waves. P to P to P is marching out, R to R to R is marching out, but I do have P waves that do not have QRSs, so I know I have a type of heart block. So now I want to know what type. So I see here that my PR interval for this one is not the same as my PR interval for this one, is not the same as this one. So it would be a third degree heart block or a complete heart block at 40. This one here, QRS to QRS to QRS is regular. Oh, I'm sorry, irregular. It started off regular, but then obviously it's irregular right here. So I have an irregular R to R. My rate is 50. I see that I have P waves with no QRSs, so I think I have some type of heart block. So now I want to know which type. So I go to that PR interval. This measurement is the same as this measurement, is the same as this measurement, is the same as this measurement. So here I have a second degree type 2 at a rate of 50. This one here, regular. QRS is regular. Oh, here it became irregular right here. So QRS is irregular right here. My rate is 1, 2, 3, 4, 5, a rate of 50. I see that I have a P wave that does not have a QRS. It's kind of highlighted it here. So P to P to P to P to P to P. So P to P to P is marching out. R to R to R is irregular. So I have a P wave with no QRS, so I'm thinking I have some type of heart block. So now I'm going to go to my PR interval, and this measurement got a little bit longer, and then I dropped the beat, and that gave it a chance to recover. So this would be a second degree AV block type 1. Now this one here, R to R to R is regular. My rate is 50. I have one P wave to each and every QRS. I have no extra P waves. So it looks like I have a sinus P wave. It looks like I have a rate of 50, so I would have a sinus bradycardia. But now when I go to measure my interval measurements, I notice that my PR interval here is 6 boxes. That's 0.24, so that's too long. But it's the same measurement all the way across my strip. So this would be a sinus bradycardia at 50 with a first degree AV block. This one here, R to R is regular. My rate is 30. I have extra P waves with no QRSs, so I know I have a heart block. So I look at my PR interval. This, not the same as this, not the same as this. So this would be a third degree AV block at 30. This one here, irregular. R to R to R is irregular. My rate is 40. I see I have P waves with no QRSs. So I go to my PR interval, and this measurement is the same as this measurement, is the same as this measurement. So this would be a second degree type 2 at 40. So one thing I wanted to point out, so that was our last one there. So one thing I did want to point out with this is if you do misname your heart blocks, if you realize you have a heart block, but you are getting them confused, a secondary type 2, you called a second degree type 1, your treatment is the same. You know you have a heart block. Your rate is slow. If your patient's compromised with it, we need to go down that bradycardia algorithm. We need to think, we can try atropine, even though we know it may not work for the second and third degree heart blocks. But we can try an external pacemaker. We can do a dopamine drip. We want to find and treat the cause. So even if we are still mixing up our heart blocks a little bit, we'll keep working on it and practice with it. But we know we're not going to hurt our patient if we know we're going down the right treatment pathways. Okay, hope this review helped.